Hello, everyone. Thank you for coming to our conference today, the Road Conference. My name is Angela Allison. I work with UCSF Fresno, and I'll be your facilitator today. Joining me is McKenna Serpa, also as a facilitator, and she will be reading your questions out of the chat box at the end. As a reminder, this session will be recorded, and so please make sure to keep your mics muted. And you can enter questions in the chat at any time as they come to you, but they will be read to our presenter after the presentation. And so you are in the presentation entitled Pre-Health Jobs During Undergrad, and it is presented by Yesenia Buenrostro Ramirez. Yesenia earned her bachelor's degree in kinesiology and minored in deaf studies at Fresno State University. Currently, she is in her gap years of her pre-medical journey. She aspires to become a primary care physician and return to the Central Valley to serve her community. When she has free time, she enjoys volunteering, and Yesenia holds an ambassador position with a Me Mentor with California HPSA and the Health Careers Connection. Along with this, she has recently started a Break the Outbreak Fresno chapter. And so I will go ahead and turn it over to you, Yesenia. Thank you so much.
Thank you so much. Hello, everyone. So as Angela mentioned, I'm Yesenia. I will be presenting to you about pre-health jobs that you can consider during your undergrad. So just a little more in detail, I guess, about myself. So I am on my pre-med path, currently my gap years. I am working as a patient care assistant currently at Fresno Yosemite Healthcare. I've been with the company for almost 2 years now. I put a little picture of my badge. I thought it was super cool that they added the little red writing that says like important medical personnel in light of COVID. So I thought that was kind of cool. And yeah, so that's a little more about me. So I guess in terms of why I am able to give this presentation, I do have a good amount of knowledge about jobs as an undergrad and working in different areas to get that exposure that you may need, in applying to medical school, PA school, or nursing programs. So I did graduate from my high school with my CNA license, and I worked as a CNA shortly after that for 2 years. If you don't know, CNA is a certified nursing assistant. I also completed the EMT program, the Emergency Medical Technician course, through Selma Valley Regional Occupational Program. I will be taking my EMT exam in January. Hopefully I pass, and then I'll have some experience working as an EMT soon. And I also have worked as a behavioral technician, and I did that for a year. Okay, so before I get into it, I really want to take some time to give you all the words of wisdom that I wish I would have, been given during my freshman year of college. And so that is to just really make sure that you're always prioritizing your schoolwork. This is just something that I feel like I kind of knew, and I just feel like I didn't take as serious. So, my freshman year of college, I started to work, coming from a low-income family, first generation. Like as soon as I was able to work a real job, like I wanted to get out in the workforce. And it was just very hard to time manage for myself. So I was, getting shifts scheduled when I should have maybe not, and I should have been studying. And, I, needless to say, I didn't do as well as I could have my freshman year of college because I prioritized what seems like my work over school. So definitely I want to make sure that you all take the time to evaluate yourselves, make sure that you have that solid foundation of time management and planning out when you can work, how much you can work, and then making sure that schoolwork is above all of that. So I definitely recommend passion planners. They're great. They break down every day by the hour, and you're able to really just make sure that you know what you're supposed to be doing at certain hours of the day. So highly, highly encourage that. So that's my little spiel. So I'll start off with certified nursing assistant. So like I said, you can complete the program through Valley ROP. I know that they have a summer program. Specifically, I think it's in Breedley, Singer, Selma, and Kingsburg. I took it, in high school. So for me, there was no cost except the scrubs we had to purchase and the exam at the end. But I know that these programs run from about $600 and up. So definitely I recommend looking at the ROP first because that's the cheapest program. And then, you can also look at just Google CNA programs in Fresno if you're from Fresno or in your whatever region you're living in. But so what do CNAs do? So CNAs, by like personal experience, we definitely help hands-on the patient. It depends where you work, but basically what we do is we assist with activities of daily living, a lot of hands-on care. We take and record vital signs, which I think is super important to do to get like exposure to, especially if you want to be a nurse, if you want to be a TA, if you want to be an MD, DO, and then you're also able to chart on patient status, so that you're with this patient regularly or throughout your shift, and you have to make sure that you know how to know the changes that you're noticing or something strange that might be important to share with the registered nurse or with the doctor. So where can CNAs work? So CNAs, you can work anywhere, honestly. I think it's a great way to get exposure in the healthcare field. You can work in a hospital, in senior living centers, private companies, or in-home care, which is where I have worked. I also did work at a rehab facility called Care Meridian in Fresno, and that one was very interesting because it ranged from patients like from 18 years of age to like 65, and they were all suffering from spinal cord injuries. So I got to understand their stories and really help them because they weren't able to do what a normal mobile body is able to do. So you definitely get that hands-on experience. So reasons that I put this in my presentation is to consider being a CNA is because, well, first off, specifically for those who want to pursue physician's assistant programs, I know that working as a CNA counts, those hours count for the recommended or the required at some programs, hours of clinical experience. You obviously get the hands-on with patients. And you also get to learn a lot of terminology. I know that there's an entire section, an entire chapter devoted to learning medical terminology during the program. So, it definitely helps prepare you for what you will be, the verbiage you'll be using once you get into these professional schools or working physician or provider. Okay, moving on. So now we're going to talk about EMT. So I can say that to become an EMT, you definitely have to complete a program. And then again, I emphasize the VRP program just because that's the one I did. It was only $300. And I say only because these programs can range up to $1,500. They are very expensive at some points. So you have to take the course, do a certain amount of hours, and then you're also required to pass the exam. Same for CNA. I don't know if I mentioned that, but you have to pass clinical and written exam. So for AMT, I know it's a written exam, which I have yet to take, but so basically what an EMT does though is that they're like the first line of response, right? These are the individuals that show up when you call 911. They deal with life-threatening issues like cardiac arrest, gunshot wounds, major bleeding, or even just, minor issues, minor injuries. But basically what an EMT does with the main role is to safely transfer patients to the hospital. This is a little more high-paced profession. It definitely will allow you to feel, if you're ready and competent to be like, in pursuing emergency medicine, I feel, because you get that rush. Which is why I personally am doing it, because I do have an interest in emergency medicine. So I'm hoping after I pass the exam, I can work as an EMT and get a feel for that environment. So something to consider if you have an interest in ED and stuff like that. So yeah, there's different levels of EMT. So there's the basic, which is what I'm going to be testing for. Certain states have intermediate, and then you can also become a paramedic. Paramedic, it requires you to have a certain amount of hours working as an EMT first, and then you're able to test into becoming a paramedic. If that makes sense. So where can you work as an EMT? So you can definitely work. Most people, I believe, for my classmates that already took the exam and passed, they decided to work at ambulance companies. But you can also work in hospitals and fire departments. I know when I did my ride along, I actually did it with the Selma Fire Department, and the firefighter was also a paramedic. And so I think that was really interesting, very cool. Fun fact, but you can definitely work just at an ambulance company, hospitals. I know that Children's Hospital has a specific job for EMTs, I believe. I think it's like a PCT, patient care technician. So yeah, I can definitely give you all more information on that. I do have a friend of mine in Newmanville that works at Children's as a PCT, and she can probably provide you with more insights to that specific job once you have an EMT license. So yeah, reasons to consider becoming an EMT. Again, hands-on experience with a patient. You also develop communication skills with other healthcare providers, right? Because when you're transporting a patient from their home, from somewhere else to the hospital, you don't just drop them off, right? you have to communicate, you have to give a report, you have to use, again, that verbiage that they use in hospitals that doctors and nurses are using. So, you definitely, as an EMT, you also learn how to assess the patient outside of the hospital, right? You have to make sure that you know the anatomy of a human body, and then you're having to physically, sometimes carry them, sometimes, if they're bleeding out, having to put pressure on them. So these are all hands-on things that I think would serve as a great, service to you as somebody who's pursuing a career in health, which is the reason I'm taking the exam and took the course, because I feel like it definitely helps us in gaining that experience. And especially if you want to learn to excel in high pressure situations, this is, I would feel, the profession that you should consider as an undergrad. Okay, now moving on to medical assistant. So how do you become an MA? So there are two ways, I believe, two different programs that you can do. So through Fresno City College, I know that they have a program, and you can, I believe, either get like your associates in medical assisting, or you could just do a certificate program. So it really depends on what you have time for. I know that the associate's degree is a little more lengthy in the process. Certificate programs are just to the point, right? They teach you what you need to know to get you into the workforce sooner. So personally, if I were to consider MA, I think I'd take that route. Unless, you have the time and you'd rather get some type of degree, not just a certificate, then you can definitely look into the FCC program. So what do MAs do? So these are the individuals that, we see when we go into our checkups and with our doctors. These are the individuals who take your medical history. They prepare examination rooms. They sterilize equipment. Of course, they take your vital signs, and they help schedule appointments. I had the honor of shadowing a PA in United Health Centers in Prairie, and I also was able to shadow the MAs there. And it's crazy to me to realize how much they do, right? Because we just see them from the outside when we go in as patients, but to shadow them, they do so much. And they, also have to learn the medical terminology. They have to understand what the doctor's asking for or what they're saying. And yeah, so they really get that experience as well of knowing how a clinical setting works. So I definitely think that this would be a great experience. And so again, where do they work? We know physician's office, hospitals, outpatient clinics, and other healthcare facilities. And so I want to note though that I know that some private practices might be willing to train you um, as an MA. It really depends if kind of like luck of the draw type of thing. I know a fellow friend of mine, she did not go through any programs. She did not go through any certification or anything like that. And, she just showcased that she's a driven pre-health individual who was doing well in school and that she could, learn quickly. And the physician was willing to take her on, and it was a small family practice, so they trained her, and so that was of no cost to her, because again, these programs can be costly. Um, uh, Depending on where you go, you can definitely search that up. Just Google, MA programs around near me. But yeah, so I definitely suggest looking into private practices and just trying it out, being like, hey, like I'm really interested in becoming an MA. Like, is there any way that you would consider, hiring me? Like, I'm a fast learner, and giving your background. So I definitely encourage that as well. And again, considering this as a job, definitely to gain knowledge on medical terminology, to understand how a physician works, and gain that experience that we all want, and that we basically do need to apply to our health professional schools moving forward. Okay, this scribing. So scribing is a very intense line of work. So as a scribe, how do you become a scribe? Or right, first of all, so there are two programs. I'm not sure if any of you have heard of the St. Agnes program and the CRMC program, which are designated more specific to college students. I know that they prefer, I believe, second years because you've gone through some college courses, and as long as you did well, earning your A's and B's, that they can see that you're a good student. And I believe the CRNC program and also the St. Agnes, I'm actually pretty sure that they require you to be pre-med. But even if you're pre-PA or if you're nursing, I definitely would still recommend applying, because it's a good experience for any field, like for any pre-health student, whatever it is that you're trying to pursue. So you definitely can also search into private practices. If the ED kind of scares you a little, because it is fast-paced, like very, very fast-paced, you can definitely look into private practices. I feel like that'd be a little more slow paced. You're still learning all the information you would if you worked in a hospital, but at a more, I would say, calm way. So if none of you are familiar with what a scribe is or what they do, so they actually chart for the providers. That could be a PA or MD deal. They follow around, like in this picture I'm showing right here. That's basically what you're doing your whole shift, is you're walking around with this computer typing up whatever the doctor or the doctor or the PA say. So you have to, I would say, to be a good scribe, you'd have to have good typing skills, and definitely a good memory, because you're typing and they're just talking and talking, and you definitely need to be able to follow their medical terminology. So something that I took at State was a medical terminology class, which I feel would be very beneficial if you all considered scribing. If not, they do give you training material when you are given the position, and they do test you to see if you're able to, meet their requirements in terms of the verbiage that's being used. So again, you can work as a scribe in a hospital or a private practice. I believe those are really the only options for scribing that I'm aware of. So again, consider becoming a scribe, because this does not cost you money to get trained, right? Like I mentioned, for the previous jobs, you do need to get a certificate or some type of degree, right? Like it's costing you money. So scribing does not cost you money, but it does require you to be very attentive, very well-spoken, and quickly develop good professional skills, because you're communicating with physicians in the health field, right? So you will definitely be able to practice your medical terminology and better understand the patient-provider relationship. So if y'all have any questions about this, I would like to invite you all to the Mi Mentor Together We Mentor Scribe panel Q&A, which I will be co-hosting with Alyssa, who's actually a scribe at CRMC. So please, feel free to come join us at our pre-health workshop with the scribe panel. So we will have 5 different scribes. If you are all interested in this, and here's a link that you can use to RSVP. If you have any questions whatsoever, please feel free to email me if you need me to send you the link directly. But this is going to be taking place on October 7th from 5 p.m. to 6:30. And yeah, so we'll have different pre-health students, some from pursuing MD, I believe, others a different profession. And yeah, so it's from across the valley, right? So we have people from a private practice, we have somebody from Turlock, from CRMC, from Madera Hospital, and from Tulia Delta. So, if you want to come ask them questions, they'll definitely be able to give you a little more in-depth and answers and provide, their experiences working at Scribe. So I definitely, inviting you all to come join us on October 7th. Okay, now moving on to a registered behavioral technician, so an RBT. I would like to say I worked as a behavioral technician, but not a registered behavioral technician. That's different. You have to take a certain exam to become a registered behavioral technician. But essentially, to become an RBT or just a BT, you do have to complete training. You have to then pass the RBT competency exam and then another exam. I, again, did not have to take these exams because I did the training, and the patients that I was working with didn't require me to be registered. But some of my coworkers did have to go through the examination process, which they said it wasn't too difficult, as long as you study and as long as you're understanding of the training that's going on, then you should be fine. But I worked with Autism Learning Partners, a company in Fresno. I definitely would recommend checking them out first. They're great. It's a good company to work for. And essentially, if you are not familiar with what a registered behavioral technician does, is that you basically implement behavior and skill gaining treatment plans. So you work under the BCBA, which is the Board Certified Behavior Analyst, and you're able to get the training, understand what is asked of you in terms of what to implement with certain individuals. And really what you do is monitor behavior, record data, and show if there's progress in the behavior changes of this individual. Many of them obviously having autism, and it really helps you in highlighting your communication skills with clients, right? And the parents, because sometimes, for the most part, you work with younger children. It's the best time to, I guess, start implementing some plans and skill gaining treatment plans. And so you really need to, kind of in a way hold your ground, because you are trained and you are doing your job, but, sometimes parents, don't understand the process. So it's a lot of, knowing how to, in a nice, calm, respectful manner, explaining to parents what it is you're doing. That's been my experience. So again, as an RBT, you can work in hospitals, schools, patient homes, which is where I worked, or residential homes as a special needs staff member, which I do have a friend who works in a home. So he's working with multiple individuals. So as a patient, as working with somebody with just in the patient home, you just get that one-on-one. But also in schools, I think that's where you would have to be a registered behavioral technician if you work in a school. So you would basically go onto the campus and pull aside, the child from their class and do some work with them while they're at school. So again, why consider becoming an RBT? You definitely gain knowledge about working with special needs individuals, which is what my biggest thing has been, is to just get a feel for all different populations, all different groups, right? So definitely got that feel for working with special needs individuals, and it increases your patient skills definitely, because you know, you're having to implement certain plans, and these children, you know, they're trying to just live as normal as possible as you and I, but they're having to be, you know, trained in a certain way to try to get rid of certain habits or implement better ones. So definitely you gain new skills. Again, this is free to do, right? We want to consider, you know, the scribing and the RBT because you don't have to pay to get certified. They pay you to get trained. At least that was my experience with Autism Learning Partners. So you don't have to pay to do this. They pay you and train you. So you learn the basics of applied behavior analysis, and this helps you in being able to support, you know, the developmentally disabled. And again, I think this is a great experience for any pre-health student, but I think if you're considering, you know, a psychiatric route, you know, I think this would definitely be a good starting point for you. Okay, so that is it for in terms of jobs that you can all consider as pre-health students. And now I want to tap in just quickly into some volunteer opportunities, you know, in case you within this presentation realize that, okay, maybe I don't have the funds to go through a training, or maybe I just don't have the time to commit to a job, and you would rather just, you know, really engage in volunteer opportunities instead, which again helps you, right, to build your resume to then be able to in the future apply to jobs and professional positions like that. So a job that I did, actually I lied, this is not volunteer, this is actually a job. I messed up my slides, but okay, so a job that I did throughout undergrad is teaching fellows, and they usually prefer to hire, you know, those who want to become teachers, but they also have specific programs for STEM driven ideas. So like when I did my interview, I mentioned that I was a pre-med student, and they were still very intrigued, you know, in hiring me on, and you definitely can work those after-school programs that are designed for STEM. STEM, the idea of STEM is more so what the main idea is, if that makes sense. But so there are different programs that, you know, us as pre-health students can take on, and you definitely learn to work with children. Let me tell you, I worked with kindergarten, first grade, fifth grade, sixth grade, and it was crazy. But I definitely enjoyed the work. They were so flexible with my school work schedule, and the pay is pretty good. You know, for being this kind of job where you're having fun, you're interacting with children, you're learning how to communicate with children. You know, this is again something that you can use as a reference point where, say, you want to work in pediatrics at one point, you have some solid foundation of, you know, I enjoy working with children. I, you know, was a tutor, and I worked these programs, and definitely a good opportunity. Okay, now these are the volunteer opportunities. So as mentioned by Angela, I did start the Fresno chapter of Fresno Break the Outbreak. This is my team. Super happy to have them all on board. And yeah, this is basically an organization that is trying to, you know, help in these difficult times. So we're trying to slow and stop the spread of COVID. We are trying to reach out to businesses, provide them with cloth masks that we ourselves make or our members. So if you have any questions, concerns about this, please feel free to email me. I would love to welcome you onto our team. And here we go. This is the other organization that I volunteer for that Angela mentioned. So it's called CAPSA, so it's California Health Professional Student Alliance. And I currently hold the position of Central Valley Project White Coat Ambassador. If you have any interest in this, in knowing about it, please feel free to email me again. And I believe, mi mentor, we will be holding a session, informational session, sometime in December, so you can hopefully tune in there as well. But basically what this organization does is it created a platform for, you know, pre-health students to really come together and educate each other, educate their communities, to mentor each other, and really help develop leadership and skills, right? And advocate for our communities. coming from the Central Valley, I think that this is very important because we obviously lack so many resources. We need to advocate for the needs of our people. So something to consider. If you have any questions, please feel free to email me. Again, another volunteer opportunity that I'm currently a part of as well is the New Mentor Board. So don't mind the flyer, it's definitely out of date, but I just wanted to put a visual. I definitely recommend applying to become an ambassador. As an ambassador, I have gained a greater network of pre-med, pre-nursing, actually even nursing students and doctors already. Like, you just gain a bigger network, which is what's important in the field, right? It's having that network with people. And yeah, so you can, just join a bigger network. You're able to plan events. As I mentioned, my Scribe event, me and my Central Cal team will be leading that. And it's just, you learn so much about teamwork. You learn so much about mentorship, which to me is like one of my core values. So I definitely recommend looking into that. I know that they're having a co-current session right now, my mentor family. So definitely recommend. And that is it for me.
Great, thank you so much. Well, we have plenty of questions that I'll start reading to you if you're ready to go.
Yes.
Can adjust this. Okay, great. So I'm going to start up here. The first question is, what was the location you worked at as a CNA with spinal cord?
It was called Care Meridian. Yeah, that was the name of the company. It was located in Fresno.
Okay. And then the next question, are there certain requirements to enter the CNA or EMT programs?
No, you just have to have the money. But they definitely are welcoming anybody into the programs. I do want to say, though, that for the Valley ROP program, they have limited spots at some point. They do have summer programs and I think year-long programs. I've considered doing the summer program just because it's accelerated, and but you still get all the experience in the hands-on work. So, but no, there's no requirements. As long as you're able to pay the fee and you commit to all the hours that are required of you, then you're good to go.
Great. And then the next question kind of goes with that one. How old do you have to be to become an EMT?
That's a good question. I actually believe you do have to be 18. I'm almost 100% sure. Don't quote me on that. I would definitely want to research that, but I'm pretty sure. I think it is that you have to be 18.
And then in relation to the EMT, what is the difference between the various levels? I think you mentioned basic, intermediate, and then the
Yeah. So the basic, again, I mentioned briefly though that like the intermediate, it depends on certain areas. And really with EMT, it's tricky because, and you'll learn if you go through the course, in different cities, different areas, they just allow you to do different things. Depending on, the company, if you work for a private company, if you work at a hospital, it just really depends. But essentially, the higher up you move, right, from basic EMT to intermediate is certain hands-on things that you can do with patients, like providing medications. And as a paramedic, that's obviously, you have more leeway on what you can do because you've got more training. So that's really the only difference is how much more you can do with a patient for a patient. And that just also depends on your region. Like if you're in different cities, it's different. So I wouldn't know exactly, what each city does.
Great. And then the next question is, do you need a high school diploma to take the EMT course? It sounds like it's more than age.
I actually don't believe so. Actually, I think you might actually, depending on the program. You'd have to definitely look into it. I think they did not require it for me for Valley ROP because sometimes I feel like they do it at high school campuses. So it depends, I think.
Okay, great. And then are you an undergraduate student or are you doing these jobs during your gap years?
So I did these jobs during my undergrad. Like I mentioned, I worked as a CNA my freshman year, second year as well. I worked as an RBT my third year. I continuously worked as a tutor through teaching fellows. Now that I'm a graduated student, I'm graduated, I still work as a PCA. And I still am tutoring as well. But I did do these jobs undergrad.
Great. And how do medical school interviewers react to paid clinical experiences?
Oh, that's a, I don't know if I could answer that fully. I would assume from what I've heard from mentors, um, any type of experience in the clinical setting is valid, right? It really depends on what you put in, if that's what you're going to get out. So the way you talk about it, the way that you express yourself and what you learned, more importantly, that's what's going to be important, right? Whether if it was paid or volunteer, you have that experience. And if it changed you for the better, or if you learned something about yourself, that's what really, I would say, is the most important thing.
Perfect. And this one is kind of like a two-parter. What do you think is better? What would you recommend, an MA or a CNA? And then do these hours would they count towards PA programs?
I know for a fact CNA hours do count for PA programs. And I would say that for me personally, it was the CNA experience that was, I can't speak because I was an MA, I was not an MA, but as a CNA, you just start to realize the importance of CNA work, right? And I think that that creates you to be a very well-rounded person in terms of, once you do become that RN that you want to be, or that PA or that ND, that you respect that individual doing the CNA work because you've done it yourself, and that's a lot of hands-on. It requires, lifting. It requires, just a lot of, emotional support to these patients. So I definitely personally would recommend CNA because my experience as a CNA was great, and I think it's going to make me a better, well-rounded physician in the future.
Great, thank you. And the next question is, how are you able to get shadowing experience?
So for that, in terms of my presentation, I definitely recommend scribing for shadowing experience because essentially you're getting paid to shadow, right? And depending on how good you are of a scribe, you can, use some of the very little free time that you have if you work in the ED to, ask questions, to, start building connections with these providers that you're working with, so that they can even maybe hopefully let you, go in on your days off to shadow them when you're not working, or simply, have them, in the future be your letter writers. So in terms of shadowing, I think that scribing is probably the best paid way, but if you want to just shadow on your free time and not get paid, then you can just reach out to physicians. Again, I highly encourage you all to make a Mi Mentor app profile because you can meet so many doctors that are willing to mentor you, that are willing to help you, and you can find somebody hopefully that will allow you to shadow them.
Great, thank you. And I believe one of the questions actually asked, do you have to be in college to join Mi Mentor?
Oh, no, definitely not. We are hoping to, expand to reaching out to high school students who are driven, who are motivated, and want to take that initiative early on. You do not have to be in college yet. If you're like a senior, junior in high school, if that's who's asking, I definitely recommend you all to still hop on there. I have interacted with a couple high school students on the app. But yeah, we're just really trying to provide resources to all three house students, whether that be, scholarships, whether it be jobs, or just networking with each other.
Great. And then we have about 5 more maybe. The next question is, can you work as a phlebotomist while doing undergraduate?
Oh yeah, that's something I wish I would have done. And honestly, kind of considering still. I definitely think phlebotomy is great. And I think you should be able to find a job fairly easy. So yeah, I definitely would encourage phlebotomy is a great skill to have. I think that's awesome, yeah.
Great. And then I guess actually this is one of the last questions. It is, when are you applying to medical school?
So the goal is to apply in 2 years, given that, everything goes as planned. So in 2 years, I hope to be applying.
Great. And then we actually just had one come through here. You mentioned that you shadowed in a clinic/hospital in Parlier. Did you personally reach out to the physicians, or did you have to call and ask the receptionist?
Yeah. So actually, for that experience, it was through HCOP at Fresno State, which unfortunately I know that HCOP does not provide that anymore. But I did do that as a second year at Fresno State, and so that's how I got that experience. But again, don't be discouraged. Like I would, if I didn't have that opportunity to do that internship with HCOP, I would have still found other ways to just reach out to email, or if you even have to just stand outside of a hospital and be like, hey, like I'm really interested in shadowing. Don't be too creepy, but that's some advice that had been given to me, in terms of finding shadowing experience.
Well, great. That's all the questions we have. I'll go ahead and hand it over to Angela. Thank you so much, Yesenia, for your
Thank
presentation.
you.
Thank you, Yesenia. That was like great information to give to all of our participants here. And to let everyone know that our final session for this evening is going to be concurrent again, and it will begin at 6 o'clock. And so you do need to go to the website to get the link, or if you already have that downloaded on your desktop, it is in the program to locate the other links. And I do see a lot of thank yous coming through, Yesenia, thanking you for all this great information. And we will be starting up again at 6 o'clock. There are, I believe, 3 different sessions. 3 different sessions you can choose from. And we will be seeing you there. Thank you, Yesenia.
Thank you so much. Thank you so much, everybody.